Okay, Assalamualaikum warahmatullahi wabarakatuh. My name is Muhammad Ismail. So today I'm going to present for my proposal FYP1. Okay, so my title is Prototype Development and Evaluation of Mobile Medical Calculator Application for ICU Setting using User-Centered Design Approach. So my supervisor is Dr. Luqman Hakim bin Ismail. This is the table of content. So what are the project background of this study? It's about mobile health and also the mobile apps. All of us has mobile device and have mobile apps. So we know that in mobile application, it can be used a variety of functions such as calling, texting, browsing, playing games and others. But now mobile health apps has drawn increase of interest. So what are the problem statement of this study? Okay, which are the drug miscalculation, fatigue nurses, medication error occurs. There are a lot of incorrect medicines dosage calculation. And according to a study, 89% of registered nurses and 92% of nursing students fail the drug calculation test. The second one is fatigue nurses. Nurses that are working in a stressful environment and complicated condition can indicate the fatigue nurses. The third one is the medication error occurs. Okay, so this happen during the prescribing, dispensing, and administration of medicines. So this is the research question and objective of this study. So the first one is we want to identify the user needs requirement, okay, to develop a mobile medical calculator application for ICU setting. The second one is to design a medical calculator application prototype, okay, using the Figma application and using the user-centered design approach. The third one is to evaluate the medical calculator application using the human factor engineering approach. What are the significance of this study? Okay, to help nurses or healthcare professionals to calculate fast and can avoid miscalculation. The second one is improve illness monitoring, more effective patient care delivery, and this can enhance the productivity of healthcare service provider. And the last one is to increase the quality treatment time. Okay, because as we know, when we are using such a healthcare apps, for this study is mobile medical calculator, the user can save the time and they can treat a lot more patients. So what are the scope of our study? Actually, for this study, we are developing a IV drip calculator. Okay, and we develop until the prototype parts and not working apps. And this will be conducted using the Figma software. And for this study, we are focusing to nursing student or junior nurses, okay, because as we know, they are new, so they must be having problem in calculations. So the literature review, the first one is the patient safety in ICU. So each year, over 300,000 ICU patient at risk because getting the wrong treatment, and also improper medical treatment causes millions of patient death each year. So it's very important to maintaining the patient safety because the ICU patient requires specialized care including long-term breathing and medication administration and others. Okay, because if we compare ICU to other departments, ICU is much more busy, and in ICU the workloads is very high than other departments. The second one is mobile health. So mobile health apps are excellent resource. Okay, it can assist doctor in providing patients with better care while reducing the cost. But some of the existing mobile health apps have very complex features and require high storage to download. So what are the impacts? The impacts is it can drain a lot of battery for the user. Next is mobile apps development, okay, which is the first one is user-centered design. Basically, user-centered design is we are creating the apps following the user needs. So we are prioritize demand of user. So this can enhance the engagement of user and satisfy their needs. Okay, next one is wireframing. So wireframing contains three types, which is the low fidelity, mid fidelity, and also the high fidelity. We can see here, low fidelity is straightforward diagram and we can sketch using paper. Mid fidelity is more detailed than low fidelity. And the third one is high fidelity, okay, which is the very detailed, and the high fidelity is sketching through the software, okay, like for example Figma. So the importance, it can help to understand the mobile app better, and also it can maintain the development process focused to the user, and finally it can save money and time on design. When we are doing the paper wireframing, we only need a piece of paper and a pen or a pencil. Figma is very user friendly interface and it is very easy to use. And then next is mobile health app usability questionnaire. Okay, other than mobile health usability questionnaire, there are SUS and PSSUQ. SUS stand for System Usability Scale. The other one is PSSUQ, which is the post-study system usability questionnaire. Okay, so MAUQ need to be done before publish the mobile apps. MAUQ is to evaluate the mHealth app usability, satisfaction, and convenience of use for end users. So each user need to complete the MAUQ using the 7-point Likert scale, which is the strongly disagree, strongly agree, agree, disagree, and others. Okay, so this is the existing of mobile medical calculator. The first one is pediatric drug calculator. The second one is historic intraocular lens calculator, automated bolus insulin, and then the prostate cancer risk calculator, and then finally is the MD Calc medical calculator. And then the research methodology for our project. So this is the flow chart. So for the problem identification, firstly, before we want to know the problems, we are going to do the focus group, interview, and questionnaires. So basically, these three is going to be done in order to get the feedback from the user. So the focus group interview we'll be doing whether by online or face to face. So we'll be discussing what are the problems happening to the user, and then the questionnaire also we will give them to answer. The feedback is very important for us, okay, to get the content for the prototype and then to create a successful prototype that following the user needs. As we can see here is a picture from less polished user interface to a much more better. So this happen when getting the feedback from the user. Okay, next is content development and validation. So development of prototype consists of two things: content development and content evaluation. So for the content development, we will select the nursing student, okay, to give their own opinion and own perspective on what are the important features or important contents that need to be added in the mobile medical calculator, and we'll be doing research on the existing mobile medical calculator. So for the evaluation part, we'll give to senior nurses, okay, and then they have to assign a 4-point scale, okay, such as this content is acceptable, poor, or very poor. So we'll be doing the paper wireframing first and then the wireframing through the Figma. Paper wireframing will be conducted first, the low fidelity to mid fidelity wireframing, because it's very important to do the low fidelity first because we want to know the content for our apps is correct or not. Okay, so we will sketch the user interface and then we'll implement the basic layout of the IV drip calculator page, because for our study, we are focusing on the nursing student. We are focusing to develop until the prototype part, not the working apps. And then our focus is to do the IV drip calculator. Okay, so the wireframing in Figma, we know that it's a high fidelity wireframe. Okay, we will follow also the idea from the paper wireframing, but we will add more features, elements, and content because we want the final wireframing in Figma more detailed. And then the evaluation part. Okay, so after finishing the prototype, it will be evaluated using the mobile app usability questionnaire, which is the MAUQ. Okay, so the MAUQ will be given to user to evaluate, okay, by the 7-point Likert scale, which is the strongly disagree, strongly agree, agree, and others. Okay, they have to answer the questionnaire, and then after that, the mean of the usability questionnaire score will be determined. So this is the Gantt chart, okay, for this research study, starting from the FYP meeting and discussion, and then the chapter by chapter. Okay, this up one is indicates the weeks, okay, from the week 1 until the week 15, because Gantt chart is also for the future studies. Okay, so for the preliminary result for our studies, we get to do the paper wireframing from the first page, sign up page, login phase, and finally the IV drip calculator page. From the paper wireframing, we'll be conducting the wireframing through the Figma. For FYP2, okay, will be implemented the logo, okay, the app content, okay, and then the IV drip calculator page will be much more detailed, and we will check again. And then for the FYP2, we know if we are using the Figma, it's basically a high fidelity wireframe. So this is the 4 main pages that we have did in this FYP1. Okay, so at the last page is the important parts, which are there are volume to be given, spaces, drop factor spaces, and time spaces. Okay, and then below it, it will be the informations for the user, such as when to use, drop factor, and why using this IV drip calculator. So the conclusion for this study is our IV drip calculator is a simple and it will assist the nursing student. Okay, it will be designed using the Figma and will be evaluated using the mobile app usability questionnaire. Okay, but also in every project we have the limitations. Also for this study, actually it do not have evidence to support the effectiveness of health apps. Finally, there isn't always evidence to support the claim that using apps improve on health. So future studies needed to create features, contents, and design for the prototype. So that's all from my presentation. Thank you so much.